This presentation is for NSP 3185, Professional Ethics and Diversity, Spring 2015 FSCJ, Dr. Kramer, the professor. My name is Todd Wimberley, and I'm presenting a cultural presentation on Filipino Americans in relation to healthcare practices. The Filipino people have had a culture highly influenced by Catholicism, European colonization, indigenous customs from ancient times, as well as inner pride and resilience. Many generations tend to live under one roof, supporting each other in everyday activities. Much of their diet and history comes from Malay, Spain, China, and America. Pancit, adobo, lumpia, and lechon are examples of native cuisine eaten by Filipinos home and abroad. They maintain an interesting and highly adaptable culture which accepts Western medicine as well as non-traditional medicinal beliefs and methods. They have a high threshold for pain and will seek help only when pain is severe. Filipinos believe in the afterlife and take the matter of rituals concerning the death of loved ones very seriously. Filipino religious beliefs. Bahala na. The Bahala na aspect of Filipinos makes them both realist in terms of being able to accept the reality of a dire situation, while at the same time possessing a tremendous inner will to survive. I have a quote here that explains Bahala na means up to God, or it is up to God, or leave it to God. And this tends to be incorrectly equated with an expression of fatalism and passive acceptance or resignation of one's faith, almost ambivalence, but it's not the case. Bahala na operates psychologically to actually elevate one's courage and conviction and persist in the face of adversity, is actually their belief in God and their trust in God that gives them heightened confidence and resilience. Quite the opposite of what it's often confused to be. This is a statistical breakdown of religion in the Philippines and among Filipino people. Catholicism, an estimated 80% of Filipinos are Catholic as a result of 300 years of Spanish colonization. The remaining religious demographic is divided among Aglipayan, which is the Philippine Independent Church, which is very similar to Western civilization, how the English Church broke away from the Catholic Church, and we have branches of religion. This is still a Christian religion, um, and it is the second largest Christian denomination in the Philippines. Has 2 to 6 million members. Then you have your Protestants. Islam is a religion found in the Philippines, and about 5 to 9% of the population are Muslim. Health beliefs influenced by Western religion, Western medicine, as well as their indigenous health beliefs prior to colonization, prior to Western influence. They still carry this indigenous health belief. Western religious beliefs do not prohibit the people of the Filipino community from shying away from Western medicine, but this group of people do maintain indigenous health beliefs foreign to mainstream Western medicine. Dennis O'Neill points out, it is important to define illness and disease differently when considering some non-Western cultural traditions. Disease is an objectively measurable pathological condition of the body. Tooth decay, measles, or a broken bone are examples. In contrast, illness is a feeling of not being normal and healthy. Illness may in fact be due to a disease. However, it may also be due to a feeling of psychological or spiritual imbalance. By definition, perceptions of illness are highly cultural related, while disease is not. It is important as healthcare professionals who treat people from other cultures to understand what their patients believe can cause them to be ill and what kind of curing methods they consider effective as well as acceptable. Understanding a culture's perception of illness is also useful in discovering major aspects of their worldview. Timbang. This is another principle related to their indigenous beliefs. It involves hot and cold beliefs, rapid shifts, fast shifts from one thing to another. They believe can upset their balance. Warm environments they believe provide health. They you shouldn't drink cold drinks or cooling foods at certain times of the day. They think that can cause disease or sickness. Extra padding. Filipinos believe that being husky or having an extra layer of insulation is actually healthy for the individual. It means they're vibrant and they're healthy. And they believe in balance. Um, a principle indigenous to health concepts that includes a complex set of fundamental principles which are based on a range of hot and cold beliefs concerning moral balances in the body and food and dietary balances is a timbang. Like I said, rapid shifts from cold to hot. Warm environments are essential for optimal health maintenance. Cold drinks and cooling foods should be avoided in the AM. Being husky by maintaining a layer of fat preserves warmth and protects vital energy. Heat and cooling relate to quality and balance of air in the body. Balance may be upset by sudden changes in weather patterns, breezes, low evening temps, the sun, etc. Mystical theories of illness, retribution from ancestors, Bangunat, your soul is actually taken or lost during sleep. Some Filipinos believe in soul loss and compulsion of the soul to wander out of the body, especially when the person sleeps. This syndrome is called Bangungat, characterized by nightmares and sudden death, and may be attributed to mystical beliefs. With a personalistic view, illness is believed to be due to actions and wishes, or even spells cast by others. People of this view also believe in mystical forces, of course. Mystical causes of illness are associated with an experience or behavior, such as ancestors seeking retribution for unfulfilled obligations. Personalistic causes may be associated with punishment and retribution by supernatural beings. To counter its effect, a stronger spirit must be summoned, such as a healer or a priest, to protect the vulnerable persons. Using holy oils, wearing religious objects, or an amulet may be recommended. Naturalistic causes may include cold, heat, drafts, thunder, lightning, infection, incompatible food and drugs, excessive stress, and familial susceptibility to certain illnesses. The naturalistic explanation assumes that illness is only due to impersonal, mechanistic causes in nature that can be potentially understood and cured by the application of the scientific method of discovery. Typical causes of illness accepted are in the naturalistic medical system include events of nature, stress, food and drugs, infection, family history. This is just showing us the other side of the coin. The Filipino culture believe in both sides. They believe in both the personalistic and naturalistic. Health promotion and disease. Avoid food that causes imbalance. Um, they believe in moderation. Parallel to this holistic belief system is the understanding of modern medicine. These two systems coexist, according to McBride. I lost 1 pound this week. Time to reward myself with a giant burger. Not an example of moderation. They also believe that their bodies are containers for collecting impurities, and they believe they should be flushed from the harmful debris. They want to maintain balance of temperature, um, and protection of their body involves both supernatural and natural forces. Risk factors for coronary heart disease. Among Filipinos, I found in my research, they have common risk factors for CHD, and these include hypertension, diabetes mellitus type 2, dyslipidemia, abdominal adiposity, overweight, lack of exercise, and smoking. Gender preferences of healthcare providers. Um, the Filipino women, especially the first generation, uh, might consider having their breast touched to be a sin. They're not comfortable by submitting to female tests done by a male, vice versa with the men. Just know when you're approaching, especially these first generation older Filipino Americans, to be cognizant of the fact that if you're a male providing services for a female, they might not want you to do anything with them as far as dealing with their genitalia or breasts, and understanding their culture would have you could understand to go to a female nurse, and a female could go to a male nurse, for vice versa, because it's actually, they consider it a religious sin. If you don't take that into consideration, you might just get caught. Filipino focus on balance and avoidance of imbalance naturally leaves them to be very conscious of cleanliness. Um, Very clean people. They believe in bathing, and I have an example of a Filipino lady here who is ready to bathe in her bathing suit. There are no Filipino cultural prohibitions against blood transfusion. It depends on religion. Christianity, there's no ban on transfusions for the major Christian religions. Jehovah's Witness, of course, no, and Muslims, no. The family dynamics. Filipinos live with several generations together and under one roof. You're often not going to see them sending their elderly off to nursing homes. They're going to take care of them within the family, from the young to the old. And the man of the Filipino family is is the head of the family. This just further family dynamics. The Filipino family structure is built on cultural values that reflect a system of cooperation and mutual support. Kinship relations are highly valued and regarded as familial, whether defined by blood, marriage, or fictive kinship. And our ethical dilemma, pain medication is scarce in the Philippines, so they don't have much. But also, most Filipinos can be stoic, so we cannot rely on the expression of pain to determine a person's level of pain and to offer pain medications as ordered. Some patients have a high pain threshold. Filipinos do not respond to illness unless it is advanced and they are in severe pain, and there are not much pain medication in the Philippines, so they are trained to use as little as possible to make it go further. Filipinos are also fearful of becoming addicted to narcotics. They hate shots. They prefer to take medications by mouth, or through an IV. And this ethical dilemma here, if we have a patient of Filipino descent, um, who has some sort of disease process or acute injury that we know is causing pain, but the person is denying it, um, as nurses, we should use our nursing judgment, and we should look for other signs, nonverbal signs. We should look for vital signs, which would lead us to, to show us that this person is in pain. We should, look for physical expression, not just the word of mouth, because with this person's pride may be keeping them from asking for that pain medication, or if it's a first generation Filipino who knows on their home from the Philippines, pain medication is very scarce, whereas here it's not. We need to take that extra step to really assess the patient and find out, are they in pain, and what can we do to help them. Here are my references, and that concludes my presentation on Filipino Americans. Thank you for watching.